Welcome back to BetterHelp's In-Session series. I'm Haesue Jo, a licensed therapist and part of the clinical operations team here at BetterHelp. Today, we're excited to be joined by Chloe Schwartz, MPH, the Massachusetts Director of Maternal and Infant Health Initiatives for March of Dimes. In this role, she's responsible for designing and implementing the market's mission strategic plan, which includes both programmatic and advocacy agendas. Chloe has a master's in public health from Tufts University of Medicine and a BA in psychology from Boston University. While working towards her MPH, Chloe designed and completed a research project with the Center for Reproductive Rights under the U.S. Maternal Health Rights Initiative to provide a strategy as to how birthing hospitals in New York City could better communicate patients' rights before and during childbirth. Chloe previously worked as an account executive in the Boston office of Cercone Brown, a national PR firm, and an account coordinator at Kell & Partners. Chloe, thank you so much for being with us on our In-Session series. We're super excited to have you here. To get us started, would you tell us a little bit more about March of Dimes and getting to where you are today?
Yeah, sure thing. Thank you so much for having me and for this opportunity to talk about March of Dimes and all of the great work that we've been doing recently. March of Dimes is a nonprofit, a national nonprofit, and I work for the Massachusetts market of the organization. Our mission is to lead the fight for the health of all moms and babies. So we work to end preventable maternal health risks and death, preventable preterm birth and infant death, and then close the health equity gap within those areas. We're a pretty old nonprofit. We celebrated our 85th anniversary this year. We were actually founded by President Franklin Delano Roosevelt back in the 1930s, initially to raise funds for the polio vaccine. And we're one of the only nonprofits out there that actually successfully achieved their mission, and polio was eradicated in the United States following the vaccination programs that took place back then. Since then, March of Dimes has transitioned its mission a few times. It was focused on birth defects for a while, hyper-focused on preterm birth for a while. It had some other well-known campaigns around different diagnoses like pertussis and rubella. And in the last few years, we've really broadened our focus to maternal and infant health at large. And so each market across the country is able to kind of tailor what they do to what the highest needs in those markets are. So what we do in Massachusetts on either a programmatic or an advocacy agenda will differ than what our counterparts are doing down in Alabama or out in California, just recognizing that we're a big country and the way that we live and the current status of things differs greatly between all of the states.
Definitely. I can imagine some of those differences for sure. You mentioned some terms that I'm thinking that some people listening in on this may not be super familiar with. So I heard things about like prenatal, postnatal health, disparities in this world. I wonder if you can say a little bit more about some of those terms and, answer the questions that haven't been asked of like, what disparities are you talking about here?
Yes, absolutely. So within the world of maternal health, so those who get pregnant and have a baby and then, deal with the repercussions of having a baby, both physically and mentally, there are a lot of outcomes, both positive and negative, that can occur. So when we talk about closing the health equity gap, we're really focusing on the differences in those outcomes among different racial and ethnic identities in the US. And what we have seen by and large for years and years and years is that families of color experience the negative outcomes at significantly greater rates than all other families in the US. Predominantly among Black and Native American, Alaskan Native families are experiencing negative health outcomes significantly more than any other family. And so when we talk about closing the health equity gap, we're trying to target all of our programs and resources to those communities, directing, programs towards healthcare institutions that cater to those communities, and really making sure that those families and communities at large are not falling through the cracks of, our complex healthcare system.
A lot of work to be done there, it sounds like, especially in such a huge country with regional differences in the ways people think about all of this. And you didn't say these terms, but I am hearing that there's probably some kind of intersection of everything that your organization is doing and mental health risks. And that's, I think, why we are talking today, right? Like if people are wondering, why are we talking to this person who's not a therapist or talking about therapy? I think so many things are related to our mental health, of course, but it sounds like with such a huge thing that impacts a woman's physical health, of course, it's going to be related to mental health outcomes also. So I'm wondering if you can share a bit more about that intersection of mental health risks and, facing preterm births, even pregnancy related complications. It sounds like you're looking at negative outcomes, which it sounds like it can also include death and inequities of care overall.
Yes, absolutely. Mental health is a huge component of what we do nowadays. Unfortunately, the CDC, Centers for Disease Control, that monitors public health across the United States, did report this year that the leading cause of maternal death, so a death that occurs due to pregnancy or childbirth 1 year, after giving birth, the leading cause is mental health diagnoses. So that includes suicide, substance use disorder, and overdose. All of those things fall within that category. But that is now the leading cause of maternal death in the United States. More so than that, 80% of the deaths that we are seeing are entirely preventable. And by and large, we can say that mental health related deaths are completely preventable if, provided with adequate resources. And so when we talk about mental health, within the context of maternal and infant health, we're, especially here in Massachusetts, catering a lot of what our focus is on towards mental health more so than we've done in the past. So a lot of our work is around advocacy and policy work at the state level, working with Massachusetts-based legislators to pass different policies that would better direct resources to moms and babies and birthing persons in the state. And my counterparts are doing that in other states too, but I think here in Massachusetts especially, we've really seen an increased need and an ask from our volunteer base and our communities to direct our focuses there. We unfortunately, in our home state, had two awful tragedies occur in 2023 that made national headlines, who both experienced the worst of the worst outcomes that a family can experience. And there were deaths involved in both of those cases. And that is the point blank exact reason why we need to be directing resources this way. Those deaths were completely preventable. Both of those moms had extensive knowledge about what was happening to them, and they were still no exception to, the worst case scenario. And so, within the policy realm, we are working on a number of bills in Massachusetts that would better direct resources to mental health services. One of the big ones is called the Moms Matter Act, and it's modeled after a piece of federal legislation that was, gone through Congress. And what that would do is create 2 new grant opportunities for organizations to grow and diversify the mental health workforce specifically for expecting and new moms. Like I said before, one of the problems we see with these resources is that they're not accessible to a lot of people, whether that's because they are financially incapable of accessing mental health resources, or they don't speak the same language, or they come from, a really distinct cultural background that just doesn't mesh with most modern day counselors. And so we really want to encourage a diversified workforce that can cater to all of these people. And that's what these 2 grant opportunities would better support. So that's one of the big ones that we're working on here. And, we're hoping that that'll create change, in the longer term. In the shorter term, partnerships like, that we have with BetterHelp are exactly what our communities need. And so BetterHelp's very generous donation of 200 vouchers to your services are going to go directly to 200 families whose babies are currently in the NICU, which is a neonatal intensive care unit. So babies that were born preterm or with other complications need increased care. Those families are much more at risk for negative mental health outcomes. And so being able to provide these free, readily available resources to them in the short term is just an absolute blessing to all of them. And we're just so excited to be able to do that. We've been working to identify which areas of the state are, underserved, catering to populations that could really benefit from these resources. And we'll be distributing them later this fall.
That's great. And what I'm hearing then is March of Dimes, the organization is really working at micro levels and macro levels, trying to get services into the hands of an individual, but also looking at policy changes. Thank you for sharing about that policy change. I've also heard and seen like hashtag blanket change, something called mom agenda. And I was wondering if you can share a little bit more about those as well.
Yeah, definitely. So hashtag blanket change for the mom agenda is it's our national policy agenda. So it's all of the different areas of policy that March of Dimes advocates for on a national level, and anything we do at the state level will fall within that mom agenda. So all of our maternal mental health work here. We also work on extending and expanding Medicaid coverage for different services like doulas and midwives, which are alternatives to OBGYN care or supplements that, really enhance a mom's care during and after pregnancy, as well as, a plethora of other policies. But everything that we do falls under that mom agenda. And, partners can use the hashtag blanket change to show, their support online when they're doing their own advocacy. And it's really our hope to be a convener. We're not necessarily trying to come into new areas of opportunity and try to take over and lead the charge, but we hope to just be a convener and really bring all of these partners together who've been doing this work for so long and help amplify all of their voices through this campaign.
And I understand that some of these efforts might even look like providing more access to the therapists out there themselves so that they're better equipped to work with this kind of clientele or even understand some of the nuances and the niche cultural things that are going to come up in this kind of community of people. So I was wondering if you could speak more on the training that has been provided to various healthcare providers and mental health related topics. I understand that there's even continuing education opportunities that have come up. So I'd love to hear more about that.
Absolutely. I would love to talk about that. So March of Dimes has a training institute specifically for healthcare providers of all backgrounds. We offer, I believe, more than 15 courses at this point, but a few are, really hyper-focused on mental health, substance use, stigma reduction, really just ways to enhance the patient experience and making sure that they're not on the receiving end of any negative care, on the interpersonal front. And so we have been offering trainings on these topics for a few years now. We recently held one with the Boston Public Health Commission's Healthy Start Initiative. That was a really wonderful example of one of these trainings. It was on our Beyond Labels training, which is stigma reduction associated with substance use disorder and mental health. And it was really wonderful because it was an open invitation to healthcare professionals in the greater Boston area. You didn't have to be a part of any one specific organization or be of a certain profession. It really brought together physicians and nurses with the public health advocates and the community health workers and the lactation consultants and the social workers. And we really saw a diverse group of professionals come together for this training. And I find that when that's the case, the discussions during, open discussion portions or Q&A portions are just so fruitful and eye-opening for so many people. And we get a lot of feedback from that of, gosh, I never even thought about the patient experience being hindered by that encounter as opposed to my own and vice versa. There have been times where even we have the receptionists or the front desk staff come participate because that could completely turn an experience right on a dime, when you're checking in for your appointment, if you're on the receiving end of some negative micro or macro aggressions or, just something else negative that comes out. And so we really want to make sure that anyone who encounters a mom at any point during her care is being educated on, how to best work with them and listen to them and making sure that they feel a part of the care that they're receiving.
What comes to mind when you were explaining all this is that phrase that so many of us have definitely heard when it comes to bringing up kids, which starts with someone growing this baby, is that it takes a village. I think when people say it takes a village, a lot of times we're thinking of like the mom's personal support system, their family, their friends that can be around in the immediate vicinity. But what I'm hearing is that it takes a lot more than just that. It takes a lot of, I think, really concerted effort to make the systems out there that the mom will encounter, capture so many of these small interactions that can amount to so much. And in all of that, what I'm also understanding then is like a traditional approach of equipping mom with all this knowledge, making sure mom knows all these things. It sounds like that has not been adequate. And so now it's about equipping everybody around also. And so I can only be very, very thankful that March of Dimes and probably other organizations are striving to do that out there. And I'm hearing there's concentration of focus on regional differences, looking at how large this country is. I imagine people out there have heard of different kinds of deserts of certain resource. The most common thing that comes to mind for me is like a food desert. There's going to be communities out there, a lot of regions or cities, even inner city places, urban areas that don't have access to fresh produce. That's like where a lot of people will heard this terminology. But now we're hearing about maternity care deserts. I think people can guess what that is. And you've kind of touched on a lot of this already, but I would love to hear some more about just the relationship between the ability to access adequate prenatal care and mental health outcomes.
Absolutely. Yes. Everything we do is intersectional, and you can tie a mom's mental health right back to all of these other things that we're talking about. And so you're exactly right. A maternity care desert is, any county where maternity care services are either low to non-existent. And so they are having to travel hours sometimes to the nearest OBGYN or to the nearest certified nurse midwife, or whoever is qualified to deliver their baby. And so what we are seeing is a very dangerous trend of these deserts increasing. We're seeing a lot of closures of maternity care units across the country, including here in Massachusetts, which is often referred to as a healthcare hub. But, right now there's a fight ongoing to close a maternity ward out in central Massachusetts, and March of Dimes officially came out in strong opposition to it because we don't want to see Massachusetts turn into the home of maternity care deserts. And unfortunately, it looks like we're moving in that direction. We released a new report on these deserts this past August, on August 1st, that really was a supplement to our biannual national reports. And these new ones really took a deep dive into each individual state, DC and Puerto Rico, to look at more of the nuanced factors that could also inhibit access to care other than just geographic locations of OBGYNs or of birth centers or of birthing hospitals. So it looked into, average travel time by car, and it looked into the rates of chronic health conditions like diabetes and smoking and different weight classifications, because those are strongly related to other adverse health outcomes like preterm birth. If you have a chronic health condition, you're nearly 50% more likely to have a preterm birth. And so you need better access to physical health services. And so when we think about the distance and the stress and that comes with having to get to all of these appointments, whether or not you can't find childcare for that amount of time, or you're going to get stuck in traffic, do you try and get a hotel room for the week that you're due so you don't worry about making it to the hospital? Because we know even in Massachusetts, we're seeing births occur in not just emergency rooms, but parking lots. There was a Home Depot out in central Massachusetts that posted about having a successful delivery in a Home Depot parking lot. And it's great that the EMTs were able to get to them on time, but we want to make sure they get to the hospital on time, where all of the resources are available. And so, unfortunately, with all these closures, we're seeing increased adverse health outcomes. It's all interrelated, and with that comes increased stress levels and increased anxiety. And when your stress levels are that high during your pregnancy, your blood pressure is raised. That's going to also contribute to adverse physical health outcomes. It might be quite traumatic to go through a delivery in a parking lot or in an emergency room unprepared. And so you might be struggling with PTSD after the fact, or, postpartum depression, postpartum anxiety. All of these things contribute to one another to, potential mental health concerns after delivery.
Whoa. Yeah.
Bit of a mouthful.
There's a lot of info there, and I'm glad that you referenced this report if people want to go look into that to get more details about what's going on. I don't know if the report goes into anybody's ideas or thoughts around what's leading to these deserts in terms of like, larger factors of where are the OBGYNs migrating to, like why is it that they don't want to live in certain areas, which prevent them from working in certain areas. I know we won't get into all of that here, but like, do you think that that's information that March of Dimes looks into? I guess it's a curiosity of mine, like of all the different initiatives and the things that the organization is doing, do you like, is there something going on to address like the just the movement of where the providers are going and how to get them to stick around in certain areas? Or
Yeah, I would say we're definitely aware of it and we watch it very closely. We have a really fantastic research and monitoring team, at our national office, who really collects and analyzes all this data on a real-time basis. And is keeping an eye out for studies, hopefully explaining why these closures are happening on a greater scale. I would say in terms of, trying to prevent these closures from taking place in the first place, March of Dimes isn't necessarily the one leading the charge on that, but we are happy to support, like we just did with, the teams out in the central Massachusetts area. We're happy to lend our voice and say, as a leading awareness raiser of these deserts, we absolutely don't promote the closure of yet another maternity care unit. So we're very happy to be on the support side of that. But there are definitely other folks leading the charge on the logistics and legal discussions around, preventing these closures from taking place in the first place. But I will say, on a larger scale, our teams at the national office are definitely monitoring the situation and really taking into account everything. And that will, lead what we do on a local level, in the years to come.
thank you for that. There's so much info that I think we could go off on so many tangents on, but I know that we're limited on time. And I do want to say, like, I've definitely heard of March of Dimes. You say it's been around for 85 years, which makes sense because I remember hearing about this organization many years ago. But a lot of the statistics you've shared have been very shocking to me. I didn't know a lot of this stuff about negative health outcomes for moms. I didn't know about the leading cause of death for moms, for example. So all this information and any of the other stuff that a lot of common people like myself may not know of, where can we go to learn more about this? And is there anything that you would recommend for people that want to like lend whatever they can in terms of support or helping raise awareness of this kind of stuff?
Absolutely, yes. You can go to marchofdimes.org, to find out all about the different work that we're doing at both a national and local level. And we would love everyone's voice. If they're wanting to contribute, the best way to do that is to sign up for our Advocacy Action Network. And so that would send you very tailored, opportunities to participate in advocacy efforts in your home state and at the federal level. It's very much catered towards where you live. As a Massachusetts director of maternal and infant health, I'm the one writing the ones for Massachusetts. And so my counterparts are writing those in other markets as well. That's a really great opportunity to participate. We host an annual lobby day that's also volunteer led. So we'll bring together all of our volunteers who want to actually come to the State House and talk to legislators about these policies and why they're important to them, either personally or professionally. And this year's focus in Massachusetts really was on mental health. We had a lot of really fantastic mental health and nursing providers come out in full force, nearly 30 of them, really advocating for the moms that they're caring for right at that very moment. We even had one of our volunteers who was a home visiting nurse have to take an emergency call during the lobby day because she had a patient who was suffering and needed to be directed towards resources immediately. And so it really put everything into perspective. And I think everyone felt equally empowered and frustrated, which I think is how a lot of us and our volunteers feel at the end of the day doing this work. It's really empowering to be among all these professionals, but it can get frustrating as well when you're trying to convince others how important this is. I studied public health and psychology and sociology all through undergrad and grad school. And I know from that experience that a society's, you know, true measure of quality of life is how we treat moms and children and babies, especially during their most vulnerable times. And the US has a long way to go, especially when it comes to mental health within that. Maternal mental health is an underrepresented, misunderstood area for us. And so any opportunity we have to raise awareness of what exactly it means is huge.
100%. I mean, I'm hearing you say, and I believe in this too, life begins with moms, right? Moms are the ones that really breathe life into everybody else. We all came from someone. And to hear something that I think is an elephant in the room, something that we all know but don't really acknowledge very much, is this absence or lack of care for that beginning of lifetime. So thank you so much to the individual work that you're doing, and of course the work that March of Dimes has been doing for nearly 90 years. Just goes to show, if March of Dimes is still so needed, then there's a lot of work to be done. Really, really appreciate your insight, your time, and your ability to articulate on so many very difficult and challenging topics so that more people can know that they need to be talking about this too, and knowing about this instead of not talking about it because it's uncomfortable or painful. And just, wondering if there's anything else that you'd like to add or things that you would like for people to know.
Yes, absolutely. There is one thing I want to make sure everybody is aware of before this, wraps up, is that last year there was the launch of a national maternal mental health hotline that moms and their support networks can utilize at any point, to ask questions or ask for resources. And so that number is 1-833-TLC-MAMA, which is 1-833-852-6262. And in its first year, it saw more than 12,000 texts and calls. And so we know it's getting utilized. But I'm sure not enough people are aware of it still. And so, again, any opportunity I have to make sure folks know about that resource, it's free, it's 24/7 available. I would be remiss if I didn't mention it on this.
Thank you so much for mentioning that. We'll try to include that phone number below in our comment description or whatever caption. And hopefully we'll be able to even share that number more broadly with people that listen to our content and all everything there. So thank you so much for sharing that resource. And thank you again so much for your time.
Thank you. I really appreciate it.